Good evening. My name is Emily Bada, and I am here to speak to this congressional committee about cigarette smoking in American adults. As a registered nurse case manager for a hospice and palliative care program, cigarette smoking is a huge concern due to the life-limiting illnesses it causes, such as cancer, heart disease, and respiratory disease. While smoking has decreased over the past few decades, it is still a prevalent issue among adults across the nation. The 2011 scorecard showed that 17% of adults smoked compared to the benchmark rate of 12.2%. Cigarette smoking in adults has decreased from 21% in 2004 to 17% in 2010. Utah and California reached or exceeded the goal of 12% set by Healthy People 2020. However, rates in states with the highest percentage of adult smokers are twice that level, proving that more needs to be done to help control tobacco use. Cigarette smoking is the most preventable cause of death and disease in Americans. It is estimated that 443,000 premature deaths occur each year, while $193 billion are spent in direct healthcare expenditures and productivity losses. Smoking is more prevalent in lower-income adults at 27% versus higher-income adults at 11%. Rates are also higher among the uninsured at 30% versus 15% for those with health insurance. The Institute of Medicine recommends using evidence-based tobacco control measures, which includes increasing taxes on cigarettes, funding public education campaigns, offering affordable programs to help people quit smoking, and enacting smoke-free worksite laws. The United States has been making progress with such developments. The combined federal and average state tax on each pack of cigarettes rose from $1.57 to $2.45 between the years of 2009 and 2010. If the national tax on cigarettes went up by $1 more per pack, it is estimated that 1.2 million smokers would quit, and $50 billion in healthcare costs would be saved over the next 5 years. In 2016, the smoking rate in adults was 15.5%. While not a large decrease, America is still making progress in the right direction to ensure people are living healthier and longer lives. Current smoking rates are highest among adults ages 45 to 64 years old at 18%, and lowest among adults 65 years and older at 8.8%. Cigarette smoking is directly related to education and income. It has been proven that population-based interventions such as tobacco price increases, smoke-free laws, high-impact anti-tobacco media campaigns, and barrier-free access to smoking cessation programs and medications have led to the decrease in the number of adults who smoke. As a registered nurse and American citizen, I am asking for further funding for accessible and affordable smoking cessation counseling and medications. These interventions should be available to everyone who smokes despite their education level, income, or age, and should be offered in the community, not just at doctors' offices and hospitals, since smoking rates are higher among the uninsured. I would like to see taxes on cigarettes increase by at least $1 per pack by the year 2020. Since technology plays such an immense role in our lives, high-impact advertisements should be more prevalent on social media. By offering barrier-free cessation interventions, raising tobacco taxes, and improving anti-tobacco campaigns, together we can continue to lower the number of Americans who smoke, leading to a healthier America with less risk for life-limiting diseases. Here are my references, and thank you for listening.